Are you a registered nurse planning to write the NCLEX National Council Licensure Examination? You want to practice in US, Australia, or Canada, and you're still reluctant in starting building your content, or you're still confused on ways to start. NCLEX exam is a serious exam that needs commitment, time, and finance commitment. So before starting the NCLEX exam, you must sit down to gather information to know what and what you need for the exam and how much you need to start the process. So for building your content, one of the ways you can have the push to build your content is one, identifying the reason why you want to practice in US. That is the first step towards pushing you to starting your process or even building your content. I bet you, if you are faithful and committed in writing, in dedicating 30 minutes to 1 hour of your time every day, in the next 6 to 9 months, you'll be prepared for the exam. But if you want to shorten your preparation time, then you have to commit like 2 to 3 hours every day of your time, of your life, every day for 3 to 6 months. Then you'll be truly prepared for this exam. There are areas where NCLEX is going to test you, and one of these areas are safe and effective care environment. Safe and effective care environment has two concepts, and one is management of care, and the second one is safety and infectious control. So under the management of care, which accounts about 17 to 23% of the exam, and it includes topics under this category includes advanced directives, advocacy, case management, clients' rights, concept of management, confidentiality, continuity of care, legal responsibilities, referral, supervision, quality improvement, ethical practice, informed concept, establishing priorities. Then under the safety and infectious control, which accounts about 9 to 15% of the exam, and questions under this category include error prevention, hazard material, surgical asepsis, standard precaution, and use of restraints. Another category where NCLEX is also going to test your preparation include health promotion and maintenance. Health promotion and maintenance include different topics like newborn care, interpartum, intrapartum care, disease prevention, health screening, lifestyle choices, physical assessment techniques, health promotion program, high risk behavior, and self-care. Another area you'll be tested includes psychosocial integrity. Psychosocial integrity accounts for 6 to 12% of the exam, and it includes coping mechanism, grief and loss, mental health concepts, therapeutic communication, chemical dependency, behavioral intervention, crisis intervention, coping mechanism, end of life care, and family dynamic. Another aspect you'll be tested is on physiological integrity, which has 4 concepts. And the first is basic care and comfort. Basic care and comfort, which account for 6 to 12% of the exam questions you will encounter on that day. And topics under this include nutrition, oral hydration, personal hygiene, sleep and rest. Pharmacological and parenteral therapies account for 12 to 18% of the exam. And topic under this category include contraindication for medication, adverse effect of medication, blood and blood products, central venous access device, chemotherapy, expected effects, intravenous therapy, and medication administration. Also, calculation, total parenteral nutrition, pharmacological management of pain are also included in this category. Then another consent is reduction of risk potential, which accounts about 9 to 15% of the exam. So you'll be tested on laboratory values, diagnostic tests, potentials for complications from surgical procedure, health alterations, as well as therapeutic procedures. Then the last concept under this is physiological adaptation, which accounts for 10 to 17% of the questions encounter under there. And they will test you on alteration in body system. How do you build your content? One of the best way to build your content is by start reading, and one of the best textbook recommended is Sounders. Most people find it difficult to read on their own. Then I will advise you to join any agency of your choice and seek guidance. Look for somebody that can guide you in the process. There are a lot of people who are out there, reliable agencies that are capable of directing you on these processes. One of the steps to starting this process is when you start reading. Start reading and start guiding and preparing financially for this process. Make sure you have the finance to start. Make sure you have the support system to carry out. Time management is also a factor in preparation for NCLEX. You have to learn how to manage your time very well. You also have to learn how to not to give excuses during the preparation. So if you are a registered nurse, a registered USRN trying to start, identify the reason why you want to start. That's one. Number two, manage your time effectively to be able to be committed with devoting 2 to 3 hours of your time every day towards achieving this goal. If you are a registered nurse and you are seeing this video, comment on the comment section so that you can help our upcoming USRN to guide them on the ways they prepared. Please, if you're watching me for the first time, please like, comment and share. See you in the next video. Bye.